Today is August 5, 2020. My name is Cristian Doña Rebeco. I am interviewing Dr. Athena Ramos for the Conversaciones Oral History Project, Voces of a Pandemic project at the Office of Latino and Latin American Studies and Chris Library at UNO. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Give me a sec, I just need to check one thing. Please know, Dr. Ramos, that this interview will be placed in the University of Nebraska at Omaha, Dr. C.C. and Mabel L. Chris Library, and share with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. Because we're not conducting this interview in person, I need to record your consent. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each one. There are several questions we need to make sure you agree to before we go on. The Office of Latino and Latin American Studies and Chris Library wishes to archive your interview along with any other photographs and other documentation at the University of Nebraska at Omaha, Dr. C.C. and Mabel L. Chris Library. UNO's Chris Library will retain copyright of the interview and any other materials you donate to the Office of Latino and Latin American Studies at UNO. First question, do you give the Office of Latino and Latin American Studies consent to archive your interview and your materials at UNO's Chris Library?
Yes, I agree.
Do you grant UNO's Chris Library right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UNO's Chris Library to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the Office of Latino and Latin American Studies consent to share your interview and your materials with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
We have many questions in the pre-interview form that we have already filled out. We use that information from the pre-interview to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to the Benson Library and Chris Library, we'll have stripped out any contact information for yourself or family members, so that will not be part of your public file. Your public file will only be accessible at the Benson Library and Chris Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson Library?
Question then. So the information will be at the UNO library and
at the Benson Library. So it'll be in 2 places.
Okay, and so this question in particular, can you read it again?
Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson Library?
So sorry, I think I agree, but I did have a question though regarding the information from the sheet that we just filled out. All of that is going to go, other than the contact information is going to be in my file?
Yes.
All of that?
Yes. Unless there's something you want me to go back and delete.
Okay. Okay, that's a lot of stuff. A lot of personal information that.
Yes.
Yeah, maybe I would take out like my kids' ages and their name, like last names and things like that.
Okay, I'll do that.
Yeah.
I'll do that. Let me take it so that I won't forget.
Okay. Yeah, I don't think I'd want all of that out there.
Not a problem.
And maybe my elementary school and middle school and that kind of thing.
Okay.
High school is fine. I'm sorry.
Not a problem.
Yeah.
Age and name of children.
Yeah. And the 2 marriage question too.
Both? I mean,
Oh, well,
in the first one, I just put none to everything.
yeah.
The second one,
Okay.
do you want me to delete the second one as well?
No, it's okay to put my husband, but maybe do we need to say that we've been married twice? That's the part I would delete and just leave one.
Okay,
Yeah,
I'll move everything to the first one.
the only one that matters. And can we also remove my parents' dates of birth? And my mother's maiden name? I don't mind the Ramos because that one we know, but the other one,
Yeah.
yeah.
Okay. I'll fix all that.
Thank you.
Not a problem.
Yeah, I didn't realize that was all going to be on a public file. I thought it was just for the purpose of the background information.
So you can. This is not a mandatory question. So you can say that you do not wish to share the rest of your interview in your public file.
Okay. Okay. Yes. Then I do not agree. Would that make it easy? Yeah.
I will still make sure that everything's deleted.
Okay.
But question 5, I'll ask it again so that it's in on record. Do you wish for us to share the rest of your interview in your public file available and make it available to researchers at the Benson Library?
No, I don't agree.
And finally, on occasion, the Office of Latino and Latin American Studies and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
Yes, and I will make sure that regardless that information is deleted.
Okay. Okay. Thank you.
All right. Now let's start with a proper interview.
Okay.
So tell me a little bit about yourself.
Sure. I'm Athena Ramos. I grew up in Bellevue, Nebraska. I've been a lifelong Nebraskan. It's something that's grown on me. I think like many kids who grow up here in Nebraska, you're always itching to get out of here and can't wait to go to a bigger city or a different place. And I think finally now I've grown into my Nebraska identity. I'm a mom, I'm a wife, I have 4 children. I work at the university, and I've been really engaged in a lot of different community efforts. I feel really passionate about working for the betterment of the community.
And by the community, you mean the entire community, mostly the Latino community?
Primarily, I work with the Latino community and trying to improve the situation here.
And what do you do at the University of Nebraska Medical Center?
Well, at the University of Nebraska Medical Center, I'm an assistant professor. I'm in the Department of Health Promotion, but I work in the Center for Reducing Health Disparities and the Central State Center for Agricultural Safety and Health. I do a lot of different community-based and community-engaged research. We do a lot of different health outreach and education initiatives, all focused on the Latino communities across the Midwest region.
Great, thanks. So tell me, how did you first learn about COVID-19?
Well, being at the medical center, we've had a little bit of a jump start on learning about COVID-19 because here in Nebraska, we received some of the passengers that were part of the Diamond Princess ship. And so when they came to town, and they stayed, many of our faculty and our staff and our folks at our hospital took care of those people as they were here quarantining. And so we got to know quite a bit about COVID early on. I think there's a lot of expertise at our medical center to be able to handle these highly infectious pathogens. And so that's why they were sent to Nebraska in the first place, because we do have the biocontainment unit at the hospital. And so they're used to dealing with these types of things. In fact, they were also one of the units to care for the people who had Ebola. So as they were bringing Americans back who had Ebola, they also came to Nebraska. So we've had a history of being able to take care of people with these types of pathogens.
So, but did you learn about COVID-19 then, or was something that you had heard before at TV or in meetings at UNMC, radio?
I've definitely heard about, I heard about COVID-19 on TV. I heard a lot of news reports. I listened to NPR, and you heard everybody talking about, oh, it's sort of like the flu originally, before we didn't know as much as we do now.
And what was your initial reaction when you started hearing about, this quote unquote new flu in China? What did you think? Did you think that was going to be just like any other cases, or that you were looking at something different, that you were watching something different going on?
Yeah, I think originally I was thinking that it was going to be something that happened over there, and I didn't see that it was going to be a global pandemic. I heard about what had happened, and there was some acute respiratory distress syndromes and that type of thing, but I didn't really think that it was going to have the global impact that it did. I thought it might be like SARS or maybe like MERS, things that happen in other parts of the world that happen for a short period of time, and definitely not as far-reaching as what COVID-19 has been.
Mm-hmm. And just let me go backtrack a little bit. You're an assistant professor. What's your degree in?
Sure, I have a PhD in international family and community studies.
Okay. So that is, but do you have classes? Is that involves public health?
This is an interdisciplinary degree that pulls together public health, human development, community development, and sort of the psychology, community psychology components.
And within that intersection, which one do you think is your main area?
Gosh, I would say more on the community psychology and the human rights side.
Mm-hmm. Thank you. All right. So going back to the question, your initial reaction was that this was going to be something that would stay in China, or at least in that region, as others have been, and not come here and not become what it did become at the end. When did you realize that this was, really serious? Was it when the first cases started to arrive from the cruise, or was it before, or was it after?
That's a great question. I think it kind of dawned on me, gosh, I'm trying to think back, probably around mid-February, that this is probably going to be something much bigger. When you keep hearing about it, and I'm guilty. I watched the Johns Hopkins map, the spread across the world. I looked at the map probably too many more times than I should have, and just watching how it played out in Europe. I know in March I was supposed to go to Europe and go for a meeting, and the trip I decided to cancel the trip. Lucky I did, because I would have been returning to the US at the time when President Trump had stopped all travel from Europe. So I was watching that spread more, trying to understand the risk that I would be taking in going on that trip. And that's when I realized, I'm like, this probably isn't a good thing. And my family kept saying, I don't think you should go. I think that's a little bit crazy. You should definitely not travel.
And were there any conversations, water cooler conversations at UNMC, the medical center, about this? Were you hearing from other colleagues in public health or in health disparities in your area about this?
Yeah, there was a little bit of talk, but at the time I wasn't really involved with a lot of the infectious disease folks. We had talked about it just amongst our team and just, kind of thinking, hey, you better prepare to work from home. Make sure you take your files home over the weekend or the things that you're going to need, because you may get that call that you're going to need to work from home. And sure enough, it did come.
Oof. So directly, how do you think that COVID-19 has impacted you? So you work from home, that's one thing, but what else?
Yes, I feel there's been a lot of impacts in terms of work and in terms of family life. You mentioned it, that we're working from home, but that really has put a stress on family life as well, because now all the kids are home from school. So there's 4 kids in my household. My husband's also working from home. That's 6 of us who are working, who were working from home or trying to do something, in home and, remote learning or work from home, that kind of thing. It also, I think, has put a lot of pressure in terms of work, not in a bad way, but just pressure. Because you are at home, you're home and you're on all the time. It's hard to turn it off. And so I found myself working all hours of the night, all hours of the day, all hours of the night, because it is hard to kind of flip the switch. When you go to the office, physically you're at the office, that you turn on and then you can turn off on the ride home. But now that I'm working in the dining room, I'm just down the stairs from our bedroom and the family room and that sort of thing. It is making it a little bit more challenging to be able to turn the switch and turn it off.
But also because your research itself and your community engagement work has shifted, right?
Absolutely. I was going there next. We've actually taken on quite a bit of work of research and community engagement work that is focused on COVID-19. So early on in April, in March and April, we kept hearing about the outbreaks of COVID-19 in meatpacking facilities across the United States and actually across the world. There's been outbreaks in meatpacking facilities. And so we actually had a team from the university who was going in and doing some site visits, and they realized that maybe they weren't getting the full story about what was going on in the plants. And so they reached out to me because they wanted to get more of a worker's perspective, or a ground level perspective of what was going on in the plants. And so my team and I called together a number of community dialogues where we listened to advocates from all across the state who were talking about what was going on in the plants and what was going on with workers' families. And they mentioned during some of those meetings, well, you really need to get the worker perspective. You should really do a survey or find a way to directly talk to workers. And so that's what we did. We followed their advice, and we actually conducted a survey of meat processing workers in May. So we had the survey open for about 3 weeks, and we had an incredible response. It was it was huge. It was much bigger than I ever anticipated. I was thinking, since we have all these restrictions on doing face-to-face interactions from the university, I thought, oh gosh, an online survey with meatpacking workers, it's going to be tough, but we're going to give it a shot. And I thought, it'd be a good day if we got 200 people to respond. But we actually had over 950 records in the system, and we had 637 usable responses. So to me, it speaks to the importance of this issue among the worker population, and the fact that they were really looking for somebody to do something to help them and to help protect them in the work environment. So the survey was tremendous, and we really worked hard at turning it around quickly. As you know, as a researcher, sometimes research projects take years, and you have, a long time to plan them out. We had about a week to plan it and put it all together. And then the survey was open for a couple of weeks, and then you got to turn it around because this is such a timely issue that you've got to analyze the data and get it out there as quick as possible so that it's something that people can do something with, that it's actionable. because we knew that those workers were counting on us to tell their stories, because they didn't have the opportunity to share their stories themselves with policymakers and with other people who can change their work environment. And so we had that responsibility to share those stories and really share their perspective. So we've worked very, very hard over the last couple of months. That's why I say working day and night. Part of it is because of the workload that we've had over this time period, and the importance of the issue and the timeliness of the issue, and being able to share that with the community.
Perfect. Yeah, I want to get back to the results of your research and the impact in the Latino community in some a little bit further down the road. I would also like to know how you've seen the impact in your children. For example, you have two that are, you have different ages, different moments in their lives. How has it impacted them? You were also getting into this while their schools were finishing and all that in May. So
yeah, it's been a real challenge. Remote learning for us has been a real challenge. I think for our school district, they had a real challenge too, because they didn't have like a one-to-one type of setup. So not all the kids had access to the internet or to a computer or a tablet or the things that they needed to do for quote unquote remote learning. And so everything from March until the end of the school year in our district was optional. So technically there was no real work. Now, I don't know, you have a high schooler. Most high schoolers don't want to do any type of work if it's not required. So remote learning for the high school kids in our family was not really remote learning in my mind. I think they tried a little bit for the younger people to have at least a weekly connection with their teacher if if the kids had access, which in our case, my kids do have access. So they did a weekly Zoom meeting with their teachers. But again, all the work is optional, and it was an hour, half hour to an hour once a week with their teacher. And so I wasn't as happy with the remote learning that happened in our school district. I think that also it created some challenges for the kids. They're used to seeing their friends, they're used to seeing their teacher and being engaged. And I think about my daughter, she loves to learn. And with the situation that happened, I feel like she's lost a little bit of that connection with reading and with learning. As much as I've tried, and we've tried, to continue that, the school is really important, and that structure that it provides is really important. And so I'm, a little bit fearful of them going back to school here next week, but in a way, I do appreciate the structure that it will bring back to their lives.
They're going to be going 2.5 days a week. I mean, 5 days out of 2 weeks?
No, in Bellevue, they're going back 5 days a week. Okay. So they're going back just like normal.
Okay. And yeah, that's going to be interesting.
It doesn't sound like a good situation.
No, it doesn't. Now, you also participate in a church frequently. You go every week. You've been involved in activities in the church. Has that, of course, that has changed as well. How has it impacted your family? Do you still attend to online mass, or how has it worked?
Yeah, it's been interesting. So yeah, you're right. All services for a while were only done virtually. And that took a couple of weeks actually to get the virtual mass going, and so now they record masses. Actually, they live stream them. The church has created a YouTube channel, and now they live stream mass, and they also stream it on Facebook. They found a great following. In fact, they've got people from all over the world who are now watching our mass. Our priest, Father Dave, he does daily masses as well, and so those are also streamed. But my daughter was supposed to make First Communion this spring, and First Communion had to be put off. It's on hold indefinitely until we're able, till the families and the parents feel like they're willing to go back to Mass. The church itself has gone back to and offered now in-person services since, gosh, I want to say about a month, maybe a month and a half now, maybe since about June, mid-June-ish. They've been offering services, but you actually have to go in and sign up to attend Mass, which our family hasn't felt comfortable in going to in-person Mass, so we watch it on YouTube. Our church has also done, our priest has also done coffee and donuts on Sundays, where he has informal discussions about different topics, and they also live stream those, which has been pretty interesting.
So while this is not a wonderful moment for anyone, do you think that, well, you said that the school, you weren't happy with how the school district resolved the remote learning. This other aspect of your life, the church, do you think that at least the local church did respond in a good way?
Yeah, I was pleased that they canceled Mass. I think that was a smart idea. I watched a number of stories as we watched the whole COVID-19 kind of explode across the country. You see these stories of people who went to Mass and they contracted COVID at Mass, or they contracted it at choir practice. And so I thought that was a smart idea to stop the in-person services. I'm not quite sure about going back to in-person services yet. If I would have been in charge of that, I would have probably held off quite a bit longer.
Interesting. So let's go back to your research and the Latino community in Omaha. You've been part of the Latino community for a long time. You've worked in several organizations in the Latino community in South O. You've also been board member and president of several organizations. How do you think COVID-19 has impacted the Latino community in Omaha in general and South O in particular?
Well, I think it's had a tremendous impact on the community in South Omaha and the Latino community. I think a lot of people are experiencing financial insecurity, job losses, or reductions in hours because a lot of folks are employed in the service industry and the hospitality industry and other jobs that are paid by the hour. And so when places like that close, it makes it really difficult for families to be able to sustain themselves. So I'm definitely concerned about the financial sustainability for folks and the food security that goes with that. For many families, they're relying on pantries, they're relying on community organizations to be able to obtain the food that they need to feed their family. I think this has put a lot of strain on community organizations to be many of them were the go-to resource anyway, but this is bringing in a greater number of people that are in need of these types of services. And so I think in that respect, it's had a huge impact. I also think there's been a huge impact in the need for educational services and information being a trusted resource. There's a lot of misinformation, I think, about COVID-19, and there has been, lots of myths and misperceptions. And so I think the community organizations have really had to step in and be that trusted source of reliable information. One of the organizations that I've been involved with is the Latino Center of the Midlands. And in response to COVID-19, they actually created a webpage on their website that has a number of different resources related to COVID-19. If you need mental health resources, if you need financial assistance, if you need information, here's a link to CDC, and it puts all the links in one page. for community members to be able to easily access it. They also, well, on their website, information is available in English and Spanish, so you can find the resources immediately in both languages, which I think has been a real benefit, a tremendous benefit to the community. They conducted a survey early on of their clients and people who visited their websites and tried to find what are the types of resources that are going to be most useful to you during these times. And many people talked about financial assistance. They talked about food security resources. They talked about educational types of resources. So they are responding to what the community has told them is needed.
And do you think that they were in some way prepared in terms of, or they had to, you know, turn around and change their activities overnight?
I think a lot of organizations had to just do this. I mean, everybody's kind of flying blind on this. I don't know that anybody was truly prepared to be able to respond to COVID-19. I don't think anybody in their wildest dreams here in the United States would have thought that they're living through a global pandemic. I think that's definitely taken everybody by surprise. But I think organizations are doing the best that they can with the resources that they have to try to provide education and support to the families that they serve. One of the first things that we did when we realized that schools were going to need to be closed, I think it was the weekend of March 13th. we actually, I got together. I'm sorry.
You mean we, the Latino Center, or we, your family, or we, UNMC?
Me as a representative of UNMC with representatives from Latino Center and State Senator Tony Vargas got together over that weekend to try to pull together a town hall meeting where we could bring in leaders from different parts of the community, like from the superintendent of the Omaha Public Schools, the executive director of the Latino Center of the Midlands, State Senator Tony Vargas. So talking about what is possible, what are the things that people need to know right now about COVID-19 and how it's going to affect our community in terms of education, in terms of jobs, in terms of the financial support and assistance available to families. So for a whole lot of reasons. And we actually did hold this town hall meeting that Sunday, the Sunday of that weekend in the evening. Because there was such a lack of resources that was available to the Spanish-speaking community. So this town hall was in Spanish, which was one of the first educational outreach efforts, I think, to the Spanish-speaking community in Omaha. We worked with Telemundo Nebraska to be able to televise this as well. And
this was in mid-March?
Yes, this was in the very beginning, in mid-March. But since then, we've engaged in a lot of different efforts to educate the community. Even my team has recorded different webinars about like mental health, about where to find resources. We've recorded radio shows, television shows in English and Spanish, to try to be able to provide the right information, accurate and reliable, trusted information to the community.
And do you have any information about whether how the community is reacting to this information? I mean, people have attended the Latino Center of the Midlands or other places?
Yeah, we've had a lot of people say that the information is really beneficial, that they hadn't heard the information before. We actually created some specific pieces for meatpacking workers about protective actions that they could take on the job and off the job, things that you should be doing when you're not at the job site, like for example recommendations on carpooling or on testing and those sorts of things. So at the time when we produced these pieces of information, it wasn't available anywhere else for folks in Spanish. And so we felt like that was a great benefit. And then we also added other additional languages as well, as we saw that there was more need. Well, we translated some of these materials into Vietnamese, into Arabic, and into French.
right? No, wonderful work. Um, and in terms of cases, um, I don't know if you know the real all the actual numbers, but what is your perception of the impact in terms of cases and family disruptions in South Omaha or in the Latino community in South Omaha?
Sure, there's a huge disparity in COVID-19 cases in our area compared to the population. So Latinos make up about 16% of the population in our county, in Douglas County, but about 42 to 45% of the COVID cases, the positive cases so far. In the zip code, which is the highest concentration of Latinos in the county, which is 68107, there is the highest number of cases that is found throughout the county. So it has had a tremendous impact and a disproportionate impact on the Latino community here locally in Omaha.
And those cases are from people working in meatpacking plants or construction or other jobs?
Yeah, I can't tell you the source of all of those cases. I can tell you there's a number of clusters related with meat processing facilities which are located in South Omaha. There's also a number of cases, clusters of cases that are associated with long-term care facilities. So there's lots of different reasons or potential clusters that have happened. But I would say that meat processing is probably a big reason for the high number of cases in that zip code, because the largest meatpacking facilities are in that area. So you have at least 5 that I can think of large processing facilities in that zip code.
And part of your research, you did a series of community dialogues. Can you tell me a little bit about who attended, what was the response of the people, things like that?
Sure. We had a variety of stakeholders who were engaged in these meetings, from educators, migrant education staff, community-based nonprofit staff, lawyers and attorneys like ACLU and legal aid and those sorts of folks, plus just people who wanted to jump on the call who thought it would be interesting to hear what we have to say. When I think UNMC has a great reputation in the community, and when you say that UNMC is hosting a meeting, people want to come, especially in the times of COVID, when you have medical center people who want to talk with you and your community. A lot of people just wanted to jump on to see what we're going to talk about and to be able to ask some questions that may have been of interest to them about what they could do to protect themselves and their families from COVID-19. So the dialogues were really to understand the ground level of what was going on in communities, especially the communities that were home to large meat processing facilities. So in Nebraska, meat processing is a large industry that spans the state. So it's not concentrated in an urban area, but it's in both urban and rural communities. And so we talked with folks from both urban and rural communities to try to understand and gauge what was going on from their minds, and also what were the resources that they needed, what was the information that they needed, and how could the medical center be a key partner for them in trying to slow the transmission, reduce the transmission, and ultimately stop the transmission in these communities.
And so from what you're telling me, the role of UNMC, from at least from your area of UNMC, has been directly on developing information, gathering data, going back with that data to the communities. Have you seen, what have you seen about the access to actual healthcare within the community? Is it available? Do they have any problems? Is it equal? Because with 40%, it is a larger proportion of people is getting sick than normal.
You're right. And you're right. And I mean, there's always an issue with access to care and access to quality care within Latino communities here. We have great partnerships with One World Community Health Center, which is the federally qualified health center, which serves the zip code, the primary area where Latinos are concentrated in this county. They're a great partner, but they can't serve everybody. They're doing their best to serve everybody. But the reality is that there's a much greater need for services than what we can provide. Testing has been an issue. When testing originally started in the communities, there was a huge lines, hours long lines for people to go and get tested. And then there were testing was only available during certain days at certain times, and that was it created it was good because there was testing, but it was bad because there was such a need for testing that fitting it into 3 days for 5 hours a day wasn't going to actually meet the need. And then I think now we've had more consistent testing, and there's test sites that are up. There's Test Nebraska, plus all of the other, like the National Guard testing that's available, plus the testing that's available in healthcare facilities. So I think now we're getting to a point where we've got testing pretty well situated for now. But I think now some of the issues are around the contact tracing and being able to follow up with people and making sure people who get tested get their results in a timely manner, because sometimes that is being a big issue, the delays from tests to the time you actually get your results. And what do you do in that time frame? So let's say you take the test today and you don't get your results for 5 days. Well, what do you do in those 5-day period? How do you protect the people that you love, your family members, or the people that you live with, from COVID if you're potentially positive, because you don't know? And so sometimes, and then you have also the issue that people, they think, well, I got tested. And so they've been tested as if they will never turn positive. And so I think that's also a constant reminder that we've got to be vigilant, and that testing isn't just a one-time thing, like you test negative and you're going to be negative forever. You got to be aware of the situations and the risk that you expose yourself to.
Right. So you have a vast research experience and community engagement experience with Latinos. How different was your research before COVID-19, and how has it changed, and how do you think it's going to change in the future?
Well, I think that's a great question. Typically, our research is really face-to-face, because working with Latinos, we want a personal relationship. We want to know who you are before we give you our life story. We want to feel like we can trust you, and a lot of that has to do with that personal contact that you have with the other person. And so talking to somebody over the phone or talking to somebody on Zoom, it doesn't really meet that need of a personal relationship. And so we've tended to do most of our research face-to-face with people, either in community locations where they're very familiar going to, or in people's homes, but it really is more about that personal connection with folks. I was laughing to myself because I've been working on a farm worker health study with Latino immigrant cattle feedlot workers in Nebraska and Kansas over the last 4 years. And in this time, we've done 243 interviews with feedlot workers over that time, which is, we thought it was amazing. It was great. This is really good. We were able to hit the number of hit the number of interviews that we wanted to complete and talk with people. But it took us that long because we actually had to go out and find people face to face. We had to make time to, go to people's homes, to have these interviews, to travel to these long distances. So we travel all the way to the other side of the state or all the way to southwestern Kansas to be able to talk to people about their experiences. And now we have COVID-19 hits, and here we have to do this meatpacking, want to do this meatpacking worker study, but we can't do anything face-to-face. Everything has to be virtual. And I was shocked at the response that we were able to get. But I would say that, you know, a lot of the response in the meatpacking worker study was not due to our efforts alone. It was due to the relationships that many of our partners had. So I still think it's going to be relationship based, but I think we have to find new ways to build these relationships. You know, it's been challenging, I'll say, to find ways to virtually connect with people. We've been doing some outreach on some other projects and trying to do Facebook Lives or, you know, have a Zoom meeting here or there to talk with people about things. It's really difficult, and I think what we've got to do is find ways to connect with the organizations that are already doing this on a day-to-day basis. So like in the case of meatpacking, well, we should be talking with Nebraska Appleseed. We've got to be talking with the Heartland Worker Center. So we've got to connect in with those folks who already have the relationship with the people that we've got to connect with.
And now, you just described how your research is going to change and how the connections themselves are going to change, or at least the process. How do you think the world is going to change? Because we all hope that this is going to end at some point, and then what comes after in terms of your children's education, yourself, your family, and everything?
Gosh, that's a hard question because nobody really knows what's going to happen. We just don't know. I would love to say that, you know, one day it's going to be life as normal, like as we knew it, but I don't know. I don't know if that's going to be the case. I guess for the meantime, you know, I've been thinking about this a lot, is how are we going to how are we going to be able to read people's faces when you can't see their smile? Or, you know, when maybe their eyes are sort of covered, you know, maybe if it's a face shield, or, you know, the masks sometimes come up to here depending on the size of somebody's face. And what does that do to our communication patterns and to our ability, like our ability to trust people and our ability to feel that connection with one another? I worry for that. Because there's so much that comes in the smile and being able to really see somebody. So that's one of the things that I worry about. I also worry about, you know, physical contact, you know, and like being a mother of 4 children, how are they going to have like a social relationship with their friends when in our case, I haven't let my kids go anywhere to any friend's house at all since March. They haven't done anything. They have been here in the house with me. And what does that do to their social development? I definitely understand the health risk of COVID-19, but I think there's also some social risk, development risk, that keeping them, like protecting them from COVID, is also creating other risk on the side.
And while we don't know, what are your hopes?
Well, I hope to be back, you know, to normal, to pre-COVID times. That's what I would hope. I actually went to my office about a month and a half ago, and I was thinking to myself, I was walking down the hallway. I'm like, how strange. I'm walking in the building with a mask on. There's nobody in the hallway. There are no office doors that are open. And how different things were just a few months ago, and how life can change so quickly. So I would hope that we are able to find a way that we can all be back together again in a way that encourages and facilitates more of the social interaction and our relationship with one another. I love Zoom, but I sure love to give people a hug too.
Yes, I understand, of course. Yeah, our children have been at home since March 3rd as well, no contact.
Yeah, exactly. I haven't even I haven't even hugged my mother, you know, since March. And it's a really strange feeling. Like they will come and they'll visit and they'll park in the driveway and they'll stay in their car. And we'll stay on our yard. Everybody's got their face mask on, and that's it. You talk from a distance, and it's very strange to not even be able to hold or hug your mother.
Yes, thank you. So those are my questions. Let me go back a little bit. So how do you think your youngest has grasped or understood this situation? It's hard to explain to I have a 5-year-old, and he understands. We think some things. You also have a younger child. How do you think he has grasped this reality, with grandmother and all that?
Yeah, the youngest, he's 2. So he doesn't really understand it. I think he's actually pretty happy because mom's home all day. But it is funny because when we say that, like, my mother is in the driveway, we call her Oma because in German, grandma is Oma. So we say, oh, Oma is here. But when he sees a mask, he's like, Oma, Oma.
That's
yeah. So I think overall he's probably pretty happy with the way things are. The rest of the kids, they're probably ready for me to go back to work.
Yes. Same here, I think. So, well, those are my questions. Athena, many thanks for this conversation. Is there anything that you'd like to share with me about your experiences in the last 6 months by now, almost, that I have not asked you about? Anything that importance about, that didn't come out in your answers or the questions before?
Yeah, not particularly. I guess I just feel it's really important that we look at the disparities that are associated with COVID-19, particularly those with minority communities like the Latino community who are disproportionately affected, with the immigrant community, with the refugee community, because there has been a lack of information and a lack of reliable sources. And so I feel like we've got to really do something. We've got to take action. It's got to be more than just talk and create a flyer. There's got to be more. And so I'm very interested in some of the legislative initiatives that have taken place or are taking place, like, for example, different bills in state legislatures to protect meatpacking workers. Since they were deemed critical, essential infrastructure workers, they have to continue to work, but they've also got to be protected. And so some of these bills in the state legislatures are trying to take it a step further and say, we want you to work, but we're going to protect you as well. So there's I want to say it was Michigan that's passed something. There's also a bill and an amendment in the Nebraska state legislature to address these sorts of things. I think that's one thing. The other thing is that we need to continue to collect data. There are many places across our state that are not collecting race and ethnicity data or not reporting it out. And I think that's really critical to be able to address some of these issues within communities, is to be able to have accurate data that also shows data by race and ethnicity. So what are the number of positive tests? What's the death rate? What are the hospitalizations? We need to be able to have this information. There needs to be transparency. In a pandemic like this, I think that's really critical, is to have the transparency in the data and be able to share that with communities. So it's not enough to just keep it at that state level or the governor or at the health department level or wherever it may be, but we need to actually make it available to people so that they can see for themselves what that data is. So I'd say that there needs to be some action and there needs to be better data. I would say those are two pretty important things that we didn't quite touch on.
Thank you. No, this is fantastic. So I'm going to stop the recording now, Athena. Thank you very much for talking with me about this, and